Hi, it's Dr.Shahin Ghadir, and I hope you're doing well. Today I'm going to answer some questions. The first one we're going to do is, does exercise affect your fertility? And the answer to that is yes and no. Excessive amounts of exercise that cause people to stop having their menstrual cycle, usually like in gymnasts and in athletes, can be definitely detrimental because not having a normal cycle is not going to allow you to ovulate normally and then get pregnant. However, exercise can be very helpful and productive and allow for better ovulation if you're overweight and you need to lose some weight. So if you're overweight, you can exercise and get down to a better weight. Usually that helps people's cycles get even more accurate and ovulate even better. So decide where you are in terms of too much or too little, but try to find somewhere right in the middle that's perfect for your body, and it should be very helpful for you. What are the things to do to improve sperm morphology? And morphology of sperm, it has to do with the head, the neck, and the tail, and the way that the sperm looks. In general speaking, it's probably one of the most important aspects of sperm quality. We look at generally the volume, we look at the concentration, which is the count, the motility, which is movement, and morphology that has to do with the look. Taking into account a clean, healthy lifestyle is very important for morphology. And what that means is that reducing alcohol to a minimum, absolutely no smoking, absolutely no drug use. Those are things that affect sperm morphology in a very negative way. Also, reducing anything that is behavioral, such as an environmental, such as excessive heat, excessive tight underwear, or anything that may affect the sperm with spinning, jacuzzis, steam rooms. Those things should definitely be avoided. What impacts does AMH levels have on fertility? And this is a really great question because AMH is one of my favorite blood tests and one of the most important blood tests in the world of fertility. AMH is the hormone that comes from all the eggs in the body. The higher the AMH level, the more eggs someone has in their body. The lower the AMH level, the less eggs they have in their body. It's very important to not only look at the number, but to take the look at the number along with someone's age, so you correlate them to see exactly where they should be. Solid numbers of AMH are anything over 1. However, it depends again on your age. If you're about 30 and your level is 1.1, that's kind of a low level. But if you're 42 and your level is 0.9, even though it's below 1, it's actually a really good level. It's the most important blood test, something that can be done on any day of the month, and something that you should definitely talk to your doctor about testing. Again, it's the AMH test. The question of should I try to conceive during COVID-19 is a very, very specific question, an individual question. And for people that are unable to quarantine, work in healthcare environments that are surrounded by patients that have been affected, or for any reason whatsoever are unable to be safe for the next year, I think it's not a great idea to start trying to conceive. However, for those people that maybe their job transitioned to be at home, they're safe, they're able to quarantine, they're healthy, people around them are healthy, they're not surrounded by any kind of affected individuals, it may be an absolute perfect time to try and have a baby when demands on life may be even easier than they were in the past, and the demands of employment may be easier as well. So you got to look at this very individually. Next question is really important. It's asking if it's too late at the age of 35 to have kids, and that is absolutely not true. First of all, every single person's fertility is a little different, so it's really important to discuss this question with your OBGYN and especially maybe a fertility specialist. However, at the age of 35, many women still have great egg reserves. They can use those eggs to make embryos and have a bunch of kids down the line, even if they decide to use them after the age of 40. So being 35 years of age is an important time to understand that you maybe should do something if you haven't done it, meaning you need to freeze your eggs, you need to freeze your embryos, or you need to try to have a baby already. So those are the important things about the age of 35. I really don't like to make a big statement about 35 like a switch is turning off the second you turn it. So maybe it's even smarter to try to discuss some of these things with your doctors at an earlier age, like 30. So is there anything to do to improve IVF? And this is a great question because improving the chances of IVF, there are things to do to make you do better. So there are important supplements that people can take, antioxidants that they can take. There are things to do in terms of checking out the clinic where you're going to see what their personal success rates are, making sure that the IVF lab where you're going has the highest and newest technologies that give you the best chances of success, checking on your doctor's credentials and making sure that they have a great success rate, if there's many doctors in the clinic, and finding out if there's a different success rate between doctor to doctor, but also the personal things that someone can do, like being the healthiest they can be, losing weight if they need to, gaining weight if they need to, making sure the sperm quality is amazing, doing genetic testing to weed out bad embryos in terms of genetics and only putting healthy embryos back. These are all things that can help in IVF success. So people are wondering if they can still get pregnant naturally if they have PCOS or endometriosis, and the answer is absolutely yes. However, many people who do have PCOS and endometriosis can potentially have difficulties as well. With PCOS, patients may not be ovulating on a regular basis, and even if sometimes they're given ovulation induction medications, they may not ovulate, and the next route of getting pregnant after that would be IVF. With endometriosis, it depends. There are stages 1, 2, 3, and 4. The higher you go with the stage, the more endometriosis you have. The more endometriosis you have, potentially you have more scarring happening internally and making it really difficult for your fallopian tubes to be functioning well and to be releasing the right egg, and a good egg that's not damaged by endometriosis, and IVF may be needed. I think these are really intricate questions that need to be answered specifically for you, so discussing it with your fertility specialist may be a great idea. Great question about how soon can I start trying after I've had a miscarriage. So unfortunately, miscarriages are very common. About 15% of our population and pregnancies end in a miscarriage. However, the good news is that many people after a miscarriage have beautiful babies and pregnancies subsequently without any issues. In the olden days, they used to tell people to wait for 3 cycles, 3 periods afterwards, because they used to time the pregnancy based on when you got your cycle. And then once they got their cycle, they were able to really find out and see when they can date the pregnancy, how far along you are. Nowadays, with ultrasounds and fertility treatment, that we know exactly what day people are ovulating, exactly what day embryos are going back into people, what I like to tell people is that wait for the first cycle after your period, wait 1 cycle after that to give your body some time to recover, and the following cycle, which is the second cycle, you can go ahead and start trying to conceive again after a miscarriage.